Good evening. Hi, I'm Emily Kratzer, one of the volunteers here at WCTV in Bergen County, Washington Township. We're coming to you from the top of Washington Township's Town Hall. And tonight we're going to focus on May being Mental Health Wellness Month, Mental Health Awareness Month. Our program tonight's part of the Mayor's Wellness Challenges in Westwood and Washington Township, and the idea is to raise awareness of physical and mental health issues. They are intertwined. They affect each other, and we're going to be talking about that tonight. Our guests tonight are Dr. Stephanie Coyne, Dr. Nansie Ross, Dr. Yolanda Hawkins-Rodgers, Dr. Caridad Moreno, and doctoral student Kellie McClain. They're members of the Northeast Counties Association of Psychologists, and in addition to having them here tonight, we have some special permission to use some video clips from the Born This Way Foundation that everyone associates with Lady Gaga and the Germanotta family. So on Sunday, May 19th from 2 to 4 p.m., the association will present a panel discussion on building blocks of resilience, as you see on our display there. The discussion will be held at the Westwood Community Center, 55 Jefferson Avenue in Westwood. And the panelists on May 19th are Dr. Coyne and Catherine Werheim and Dr. Robert McGrath. So tonight we'll be talking with our panelists, our guests. If you folks would go around and introduce each other, we'll start with Dr. Coyne.
I'm Dr. Stephanie Coyne, and I've been a licensed psychologist since 1991. I currently have a practice in Rivervale, where I work with adults from the early adult years through the senior years, do a lot of Medicare work with older adults. And in addition to being a part of Northeast Counties Association of Psychologists, I've also been involved with our state association, the New Jersey Psychological Association, and I'm currently the past president of that group. And I've also been a resident of Westwood for some 43 years, so I'm a local girl.
There you go, very good. Dr. Caridad Moreno.
Good evening. I'm Caridad Moreno. I was born in Cuba and I immigrated to the United States as a child. Thus, I consider myself to be bicultural, and I'm bilingual in Spanish and English. I have worn many different hats in my profession as a psychologist, but currently what I'm doing is I take care of children who have either cancer and/or blood disorders, and I work with them and their families. And I also have a private practice in Hawthorne, New Jersey. That's CRM Psychological Services, which I founded. And I am happy to be here tonight and to talk with all of you about May being Mental Health Awareness Month and the importance of mental health.
Yeah. Dr. Ross.
Yes, hi. First of all, I want to thank you for having us on your show. This is a great opportunity for us to talk about mental health issues and mental health awareness. I am a psychologist in private practice in Ridgewood. I'm also the current president of what we're going to call NCAP at this point, the Northeast Counties Association of Psychologists. I see in my office very young children. I've seen children as young as 2, and adolescents, and also adults, older adults as well. Right now my practice is mostly adolescents, which I enjoy very much.
Yeah, very good. Doctor, are you hyphenate on this? Hawkins-Rodgers?
Yes, that's
there
it.
You go. Okay.
Dr. Yolanda Hawkins-Rodgers, and I'm very happy to be here as well. My past life, I was the chair of the psychology and counseling program at Fairleigh in Madison. And in my second coming, I have my private practice running in Hackensack. I do consultant work for DCP&P, Department of Child Protection and Permanency, so I do a lot of psychological evaluations. And since my second career has started in terms of my private practice, I've had a chance to do some publishing. I just published a therapeutic coloring book for adults. So my practice focuses on couples and adults and adolescents mainly at this point. and I'm very happy to be here tonight to talk about mental health in the community.
Very good. Kellie, tell us about yourself.
Hi, I'm Kellie McClain. I am a school psychologist, recently earned doctorate in school psychology. I'm wrapping up my internship now at Glen Rock Public Schools. I have experience with all age ranges from pre-K to 12th grade. I've also worked as a consultant for social emotional curriculum in Jersey City middle schools. So I have just a wide range of experience with children of all ages, of all ability levels, and really looking forward to spreading awareness about what a school psychologist is, what they can do for students and for the community and for parents, and just kind of taking a preventative approach to identify any students at risk and spread awareness of what resources are available to them.
Mm-hmm. Very good. So let's talk a little bit about what's the difference between a psychologist and a psychiatrist and licensing, because what folks don't know is that we had a wonderful chat beforehand in our local green room, if you will. And so we covered a lot of things that we wanted to reinforce for the public. You folks have gone through a lot of schooling and got licenses. And these days I see life coach out there. What's the difference? Have at it, folks.
I can tell you what the licensing requirements are for a psychologist in the state of New Jersey. A doctoral degree is required in psychology or in a closely allied field. In addition, you have to complete 3,500 hours of supervised practice. Half of that is done before the doctoral degree right now, and the other half, another 1,750 hours, is done after the doctoral degree is received. And the requirement there is that you receive 1 hour of face-to-face supervision for every 5 hours of client contact that you have. Once you complete that, you sit for a national licensing exam, which is given to psychologists to be across the country. And once you pass that, then you have to sit for you take a jurisprudence exam in the state of New Jersey, so that you're familiar with all the requirements related to mental health and the responsibilities as a psychologist in the state. Then you are a licensed psychologist.
Wow.
And after that, you have to complete 40 hours of continuing education every 2 years in order to maintain your license. The major difference between us and psychiatrists is that psychiatrists are medical doctors. Their degree is an MD. Our degrees are PhDs or EDDs or a PsyD, a Doctor of Psychology degree, which is what I think Kellie is
Yes,
earning.
recently earned.
Recently earned. And psychiatrists can prescribe medications. Psychologists do not have prescription privileges in the state of New Jersey.
So the psychologist is sort of the talking doctor?
Mm-hmm.
The talking, or the talk therapy.
Yeah, but psychologists do a lot more than simply therapy. Psychologists, one of our areas of specialization is assessment. We are highly trained in psychological assessment, which really covers a broad range of assessment: cognitive assessment or intellectual assessment, learning assessments, personality, emotional assessments. Yolanda probably in her work with DCP does evaluations.
To evaluations, we do research. There's some psychologists who only specializes in research. They don't see clients. And then there are industrial psychologists that we don't talk a lot about. They're usually hired to work in corporations to understand environments and how that impacts the individuals. So there are many, many different careers in psychology, but we mainly hear about those who have direct contact with clients. And then there are those who are just in academia who teach and prepare others to go out into the field of psychology and work with the public.
Our field is very heavily based the field of psychology is very heavily based on a research basis. So our model as practitioners is that of the scientist practitioner. And that distinguishes us from some other professions as well.
There are also many psychologists who are specializing in health psychology and who are doing a lot of work in the area of integrated healthcare, where they focus on all kinds of health conditions And it's very important to keep in mind the connection of mind and body, and how the mind, what we're doing with our mind, our thoughts, beliefs, attitudes, affect our body, and what we do with our body affects our mental states and our mind, and the interrelation between the mind and the body, and how it's very important, essential, to take care of our mental health in the same way that we take care of our bodies.
Yeah,
and so
indeed.
that has been very much a focus of psychology in the past, I would say, decade, a big focus on health in health conditions.
Right, the interdependent, if you will, relationship between the mind and body is so important. And we had also brought up the concept of the amygdala, when it kind of fires too much, and how do you pull that
Yes.
back? Maybe talk about the role of the amygdala, because we're talking about a brain thing here that happens.
Well, we know there's been a lot more research in the last, I guess, 10, 15 years to look at how the brain chemistry is affected and how trauma affects the individual. So we now can look at MRIs and look at the brain of a child who experienced trauma and how they manage stress and anxiety and how that affects their behavior. So it's not simply that the child is misbehaving. There might have been traumas early in the person's life that has led to some real changes in the way the brain functions.
And it's not just trauma. The research has found that any kind of severe stress, even in utero, can make tremendous changes in brain development. And you can see the results of that in behavioral difficulties or emotional difficulties.
Yeah.
And the research also shows that psychotherapy can actually alter those changes
Exactly.
in brain functioning.
Right.
Part of the value of psychotherapy in trauma work.
I think, correct me if I'm wrong, but the right kind of counseling and psychotherapy can help a person feel reconnected and not alone, and get some of that back out in order to be able to cope. Is that correct? I think sometimes the feeling of loneliness, or that I'm the only one, maybe inhibits people from reaching out, getting help and talking with people.
Well, there's a great deal of stigma around mental health still, but I think Bergen County has done a really good job. I think every municipality in Bergen County has a stigma-free program to begin to educate people that it's okay if you're experiencing some trauma, some stress, you feel depressed, that there's nothing wrong with seeking help. So I think we've come a long way in demystifying what therapy is about, and that it's a healthy thing to be able to recognize that you need help and to seek it. So I think we've come a long way with that. And programs like this certainly
there you go.
promotes it.
You can see on the screen that we have the stigma-free zone publicity that you see in Washington Township, in Westwood, and around other places, not only in Bergen County, but in the state of New Jersey. It's become a national thing because we want people to reach out. We want them to think about getting over that hump, that hurdle of asking, just asking, and knowing when to ask too. I think about hormones. Some of us have got hormones that go crazy, and you know that'll pass, but what if it doesn't? Like you guys were saying, the stresses, the stresses that we all cope with.
That's an important message to get out about the stigma that's often attached to mental health issues. And a big part of our presentation on May 19th is going to address that, because we want to make sure also that even though there may be a stigma attached, and people need to understand that there's a large population who is seeking mental health services and getting help from those services, there are plenty of people who can't afford it. And it's a big problem in the whole country that there's a need and that there isn't a lot of affordable care. So on our program on May 19th, we are having someone from Bergen's Promise, and we're having tables from other community health organizations,
Right.
because we want people to know that even though we're trying to open the door to therapy, we want to make sure that when they find that door and walk through it, that they're not walking into an empty space, that there actually is
Right.
going to be help for them, whether they have insurance, whether they don't have insurance, or have high deductibles, or just can't afford.
Right,
therapy.
yeah. It is important for people to know it's out there and it's accessible. There's the sliding fee concept. There's insurance reimbursements. I know on April 12th, Governor Murphy here in New Jersey signed a Mental Health Parity Act, and let's hope it goes into place the way it's supposed to, so it helps people. I have a bit of a graphic here that, and I apologize because I don't know the source, but I did see this recently, where all of the states in red, I don't know if Shane can get that or not, but all of the states in red are getting a failing grade in mental health parity and coverage. Illinois in green is the only state with adequate, getting an A, in mental health parity in terms of insurance and coverage. So it's kind of disappointing. You know, I had read that although California is one of the states that doesn't have parity, it has laws which mandate parity. So implementation and follow-up clearly are lacking in some of that. We just saw on that slide that was just on the screen, and I'll just go over it, the topics on May 19, self-care, there you go, healthy coping with life's problems, stress management, mind-body connection, crisis intervention, when to seek help and how to find it, and community resources for families with or without insurance. So those are, again, very important topics that I know you'll be going over. The crisis intervention is absolutely crucial too, because people have meltdowns. It happens, stuff happens. And I wanted to recommend to our viewers the mental health first aid. This is something that was offered here locally a couple of years ago and is available if you look it up, mental health first aid. It is a course you can take just like if you will, regular first aid in terms of helping the body. You can also help someone who's going through crisis or through stressful times. So let's give a plug for mental health first aid. And other resources out in the community. This is interesting because this one came to me in the mail. I am not my illness. So there's pamphlets that come out from our health organizations here in Bergen County that are available. Again, this came in the mail. So that's from Hackensack Meridian Health. And out at Park Ridge Library, and I'm sure this is in other places, there was a magazine. When you go to libraries, there's so many resources there. So you've got this one. There you go. Okay. Thank you, Shane. So you've got this one, and one of the really good topics on this is your teen moody or depressed? And how do we judge that? Who knows? But when you reach out, someone can help you discern that and discern what to do for the person. I wanted to kind of touch back on the stress in childhood. When I was much younger and going to my community church where I grew up, there was a little girl who was always acting out. She was impossible to manage. You know, we didn't think anything about it. She was just a character. And it wasn't until years later we found out that she was being sexually molested. So how children give evidence is not a direct thing at all. How do we help those?
Well, I think it's important to seek help, to have somebody who's a professional to help navigate that, because it could end up that, it's just a mood swing or it's just a phase. Children going through those developmental stages can go through a lot mentally, and it might, pass, but it might be something that there's something deeper there. And again, it's really important to have just a professional consult with that and have them help walk you through it, or help a parent walk through it and see exactly what might be going on.
It's a delicate thing all over, because none of us would have thought about this, and she didn't have the resources to speak about it. That's what's really hard for me, is to cope with.
Well, and children often can't speak about it. They lack the reflective ability, they lack the language, but they act it out in their behavior. You saw the acting out child, but the terribly withdrawn child can be equally of concern. Changes in children are usually warnings that something is going on. A child who's usually easygoing and pleasant suddenly becomes very irritable. Sometimes depression in children manifests itself as irritability. So you've got to kind of watch the way the child is acting and interacting.
And that could be any age of child. That could be a very young child, it could be the teenager.
Absolutely.
Right?
Absolutely.
And children are very protective of their parents and other adults in their families. And also they're dependent. And they may be dependent on the person who's abusing them. And that creates a terrible dilemma. And they have no words, or they're not courageous enough, or they just can't talk about it and don't. And they also don't know what's right and wrong sometimes. And sometimes they're just confused about what's happening to them.
And oftentimes they think whatever is happening to them is normal. They don't
know.
understand.
They don't have a point of
There's a
reference.
term that's been coined in the last, I guess, 10 years or so, called adverse childhood events, or adverse childhood experiences, ACEs. And in the research that's been done, it's amazing to see how widespread ACEs actually are in the population. And these are related to trauma, these are related to different types of behavioral difficulties.
And some of it can be chronic trauma, things that children can't escape for whatever reason. It might be just environmental, and it causes kind of this like fight or flight response, and it's not good.
And there's, now we look at complex trauma that children have had. A child who's been placed in many different foster homes over a period of a short time. I know of a child who was 6 and had been in 10 foster homes by the time he was 6. So we're now looking at why was his behavior so outrageous as characterized by all who took care of him, because he had inconsistent care through all those different foster home experiences. So we're looking at complex trauma differently. Now, other part of our job is really educating parents who have children who've been traumatized or who've been characterized as behavioral problems. So we do a great deal of work around psychoeducation, really helping parents develop better skills, in addition to going into the schools and educating the teachers about what they see. It's not simply the behaviors or manifestation of some other symptoms that are going on with the child. So a lot of our work centers around educating everyone who has some contact with the child.
And for an adult to look back and say, oh gosh, this happened to me, and maybe I need to start talking about it. One thing that comes to mind when you talk about this youngster who had 10 homes in his 6 years of life, I had an acquaintance whose marriage broke up basically because her husband wouldn't talk about things. But it was because he got shunted from family to family to family, so he shut down. He didn't act out, and he didn't talk, and he didn't communicate. So it can have lifelong consequences.
Absolutely, absolutely.
Very often children who are acting out and we see their behavior as being very difficult to manage, and certainly it's not functional, it's not adaptive for them. But we see it as the problem. Whatever their behavior is, we feel is the problem and needs to be fixed. But I like to conceptualize it a little differently. I see the problem as the symptom, and we need to find out what the actual problem is. What is it that they're trying to fix with their behavior that's so difficult? So we have to look really under the surface. We might want to relieve some symptoms so that they can get along better in the world and not have consequences of that. But really, we have to find out what's going on under the surface. Otherwise, whatever the problem is can manifest itself in different ways. We might fix a symptom, and then it will pop up somewhere else as something else. So I like to think of the behaviors that we call problems, whether it's addiction or aggression or even withdrawal is not the problem. That's a symptom of the problem. And we need to know what the problem is.
And that's true across the lifespan.
That's right.
You know, essentially.
Exactly. Exactly. Hold that thought for a minute. I think this is a good time while we're talking about children and youth to introduce one of our videos that we've had permission to use from the Born This Way Foundation. We'll run with it when it comes up, but we did get special permission from them to use some of this footage. And Lady Gaga's situation, and the foundation has reached out to a lot of people, a lot of young people, to help them cope with a lot of things they're discovering about themselves and may not have reference points for. I was looking at some of her information, and in addition to whatever stresses she had the stress of being a celebrity, but that's another whole situation, because that can be very hard to handle too.
Hello, I'm Cynthia Germanotta. My daughter, Lady Gaga, and I co-founded Born This Way Foundation. As a mom, it's hard to watch your children experience the difficult emotions that we all feel sometimes. My own daughter suffered from anxiety and depression for most of her life. There were many times I felt helpless. I didn't understand the depth of these problems and the lasting impact they could have on a young person's life. As much as I tried to help, I always tried and always wished that we could give her more guidance. It was painful to watch my daughter struggle for answers and ways to cope. Through Born This Way Foundation, I've met so many young people who feel the same way. If there's one thing these young people have taught me, though, it's that telling your story is very powerful. Over the past 2 years, our Born Brave bus has traveled the country and had direct contact with over 150,000 young people. I loved hearing each and every one of their stories, and I look forward to hearing yours. I want all of you to tell your story and join the emotion revolution. Go to www.bornthisway.foundation and tell the world how you feel, and more importantly, how you want to feel. Last year, through our Born Brave experience study, we learned that young people want and need each other. To build a kinder and braver world, we need you to connect to one another. Together, we want you to ask yourselves and each other what inspires and empowers you the most, and what's holding you back at home, at school, and in your community. You deserve to be your biggest fan. Working together, we can make the world a kinder and braver place where all voices are heard and all feelings are respected. As a mom, this issue is deeply personal to me, and I know that it is to my daughter. Born This Way Foundation has taught us the power of telling your story, and we want to hear from you. Thank you so very much.
And we thank the Born This Way Foundation for giving us permission to use that video. It's very moving. It shows that this is a national thing. We're talking about an event that's going to happen in Westwood. This is Bergen County, and it's everywhere. We all need to be aware of this on many, many different levels. The cultural thing we touched on very briefly, to be sensitive to issues that come out from different parts of our society. You've got Euro, you've got Caribbean, you've got Hispanic, you've got ethnic, and everything that comes out. So let's touch on that a little bit. How do we be sensitive to people for those other different factors?
I would like to comment on that. The culture, somebody's race, someone's ethnic background, gender, these are all integral parts of the person's identity. And therefore, it's extremely important that within the counseling or psychotherapy experience, that these components of the person's identity be addressed. So in other words, it's important that the person, when they're in psychotherapy, that they feel comfortable with the person that they're working with, the psychologist, and that psychologist be mindful, be sensitive, and culturally competent in terms of those issues that are part of that person's identity. And so, for example, if someone is bilingual and their preference is to speak in their native language, then they really should seek out the services of a psychologist who speaks in their language. Sometimes there are experiences that happen at a very young age that for the person to access those experiences and to talk about them, if they happened in their language of origin, it's really best that they be processed in that language. So certainly there are psychologists out there who speak different languages, Spanish, Chinese, Creole. Sometimes the person may be fluent in either language, may feel comfortable with an English-speaking psychologist. Still, that psychologist needs to be sensitive and respectful of that person's culture, in customs, in ways of functioning that may be different based on the culture that they came from. And so when someone is looking for a psychologist, because we've talked about a lot of different issues and problems that psychologists can help with, but it's important for someone looking for a psychologist to feel comfortable with the person that they're working with, to feel that they can trust the person, that they can speak to them about all kinds of issues. And so some people may question, well, how do I go about finding a psychologist? Well, you can talk to your relatives or friends who may have been in psychotherapy or counseling. They may give you the names of the person that they worked with. Or you can speak with your primary physician who might recommend some people, or you can call an association such as the Northeastern Counties Association of Psychologists, or NJPA. You can look up on the websites, contact insurance companies. So there are many ways of finding a psychologist, but there comes the time when you have to make that phone call and when you have to make that contact. And you have every right to, as a consumer, as a person who's seeking psychological services, to ask questions of the psychologist in terms of their education, their training, their level of expertise. Not all psychologists specialize in trauma. So you can ask questions, you can check on the status of their license. So please, as a consumer, as a person who's looking for psychological services, you should feel comfortable in asking questions of the person that you're potentially planning to go and see, just as you're looking for a doctor. So I want to emphasize that very much, and you have to feel comfortable. You can get a feel for the person on the phone and take it from there.
Right. I think that, Carrie's last point is really critical. You have to be comfortable with the person that you're seeing. You could be with a wonderful therapist, highly qualified, but if you're not comfortable with that person, it's not going to work for you. Someone once described it like shopping for a dress. Sometimes you've got to try 3 or 4 on before you find the one that fits properly. And I think that's also true. I've had people call and say, I'm going to be interviewing 3 or 4 people I'd like to interview, and I think, what a smart way to go about this,
Absolutely.
And as Carrie said, there are places you can look to find a psychologist. NCAP has an online directory. The New Jersey Psychological Association, if you go to our website, the NJPA website, there's a Find a Psychologist tab, and you can put in your area where you live, and you can find a psychologist. Several psychologists there.
If you can't grab all that information, you can go online to ncap.org, I believe it is.
That's our webpage right there.
Yeah, there's the webpage, and you can go online to that and get more information to suit your needs. One thing I'm thinking about too, I don't know if this is something we can speak about. It could be a whole show, I think. But the residual effects of the African American experience in the United States, I'm sure that we are all dealing with people at some level who are still suffering from a bad history here in the United States. And being sensitive to that is hard. I've heard the term epigenic, where stress travels through the genes. We may not be aware of it.
I think there's a lot of research now that talks about some relationship between the higher levels of high blood pressure in the African American community, the higher infant mortality rate across SCS and African American community. We see a much more correlation between that and the level of stress based on the racial conditions in the country, where Caribbean women who came from their islands in the Caribbean or even came directly from Africa had lower levels of high blood pressure, but after being here 2 or 3 years, we saw an increase in high blood pressure in the women who were having children and a higher mortality rate. So that suggests that there's something that's happening here in our country that has an impact. And so we also know from a study done by Dr. Joy DeGroot, there's a theory about post-traumatic slave syndrome, that it's still transgenerational. It has an impact on indigenous blacks feeling comfortable about going to therapy and trusting therapy, and also has its roots in the fact that African Americans are more prone to their religion and their spirituality that says if we adhere to that, we don't need outside help. And a sense of trust has to be built with the therapeutic community. And I see a big change. We've done a couple of different programs in the last month in CAP and in NJPA to present an Afrocentric approach to therapy that works with some clients, and not all, but to be sensitive to those things that I mentioned: transgenerational history of slavery and distrust, and being aware of the importance of including spirituality in therapy. It's very important. And so psychologists are being open to enhancing their training to be aware of that, and to ask the client, what's important to you, what's happening to you, how are you seeing things, how is your life being impacted, and that sensitivity makes a connection with the client and the therapist. So we're really working towards making things better. Right. As we become more aware that we can no longer ignore this as a country, as American culture.
Right. And I apologize for interrupting. And I think too, it's healing the family, because there's been a history of breaking of families.
Absolutely.
Family lines.
Absolutely.
Yeah.
One of the things we've been very excited about is what Yolanda just referred to, is that within the last couple of years we've been working together at the state level, where we have formed a coalition with the New Jersey Psychological Association, the New Jersey Association of Black Psychologists, and the New Jersey branch of the Latino Mental Health Association. And we just had our first program last month, and Yolanda was one of the presenters, where we looked at psychotherapy from all different perspectives, and we see it as very important in developing a multicultural awareness among therapists, developing sensitivity to these factors, because they profoundly influence life and the psychotherapy experience, And Yolanda was referencing epigenetic effects with African Americans. That's been found in the second and third generation of children in Holocaust survivors, in the children and grandchildren of Japanese internees during World War II. So trauma affects DNA, and that gets passed on to the next generation.
Right, yeah. It's almost biblical. I think we all know that reference to the sins of the first generation going down 6 or 7.
Yeah, absolutely.
It's an ancient knowledge that we're rediscovering, that yes, that if it happens bad here, there's that ripple effect down the generations, unfortunately.
I also want to emphasize again, to come back to what Carrie was talking about also, is that therapy is a very special kind of relationship. I think all of us who do therapy feel that ourselves, that when we're with a client or a patient, that we feel it's a special relationship. And if the person sitting across from us doesn't feel comfortable, it's not going to be special. It's going to be like every other experience and every other relationship that person may be having out in the world. But when you're in a psychologist's office, it has to be different from the rest of the world. Otherwise, you're not going to help that person develop better coping skills, be able to manage their emotional distress or whatever it is that they came to you for. So the therapist has to be very much aware of the cultural factors, the history of the particular person sitting across from them, and anything else that impacts their sense of themselves, their sense of self. I had a really powerful experience a while ago with a woman who spoke Arabic. I don't speak Arabic. We were doing therapy in English, and her English was totally fluent. And she was telling me something very moving. And I said, why don't you tell me that in Arabic? I didn't understand a word of it, but it was a powerful intervention because she was speaking her own language.
That's right. We heard you talk about that you do a lot of Medicare, that age group. We've talked a lot about children and adults. Guess what, adults? You're kind of on your own. You're smart enough to figure this out and get some help. But when we see an elder start to decline and have to adjust to more and more disability, none of us wants to be disabled. We want to be independent. We want to cope. We don't like it when our body falls apart. But when we see this happening in our families, if the person doesn't take the initiative, how do we as family members take the initiative? What is it that you deal with the elder population?
You know, I think it's a very large growing section of our population, and loneliness is such a particular problem as people grow older, because the people who have formed their support group move away or they die. And loss is a constant experience for people, even fully able-bodied people with sharp as a tack. So there's I see a lot of anxiety and depression in the people that I work with, and the ability to sit and talk with someone is so crucial to them. Oftentimes they don't have anyone they really can talk with and really open up to, without somebody trying to make them feel better or assuring them that everything is okay, but just letting them communicate what their reality is. I found, having worked with people across the lifespan, from my own perspective, I think psychotherapy is extremely powerful with seniors. It's a very special experience, and they are people who do not miss appointments. They eagerly look forward to it and utilize the time really well. And it's a very effective intervention for both anxiety and depression in the elderly.
I have to say something. When I hear you say that it's powerful with the older population, it's really powerful with adolescents as well. Because, and in a similar way, adolescents want to be listened to. They might not act like it all the time, but they really want to be heard. And a lot of times they're not heard. They feel powerless and helpless very often. And it's amazing how a teenager who is known for being silent and morose and has turned inward will come to therapy and just open up and just spill out everything that's on his or her mind. So it's not just older people, and it's not just adolescents, it's everybody.
The experience of being heard and understood.
The experience of being understood.
I think that's the real power of psychotherapy.
I also wanted to mention, sometimes there might be a person who's in need of help but doesn't want the help. And so psychotherapy comes in different modalities. So it can be individual psychotherapy, it can be group, it can be family psychotherapy. Sometimes I've had situations where someone has come to my office on behalf of another family member, and then we've had really what was needed was family psychotherapy to enhance the communication, to deal with different issues that were impacting on the family. And then the person who might not have wanted to be part of a counseling process may come around and feel that, okay, I'm going to get my own therapy now, my own individual psychotherapy. So I wanted to make that point that there are different modalities of treatment.
I find that too in my practice. I see a lot of adults between the ages of 30 and 50 who come to therapy at the point that their children have reached the age when they experience trauma. So their child triggers memories for them, and then they're ready to come into therapy to deal with some past issues that have circulated in the family for a very long time.
And it's never too late to deal with those.
No, it's never too late.
Yeah.
Much the same way people tend to come into therapy when they're experiencing the empty nest for the first time.
Absolutely, right.
Children kind of suck up the air for you and take up all your time, and suddenly being involved in all those activities is gone.
Right.
And people start to recognize issues that they hadn't paid much attention to prior to that time.
Yeah, we have a slide on dealing with stress. I'll talk a little bit while we punch the right buttons, but there's some advice on managing stress. Let's see how this works. We seamlessly transition from one thing to another here. But one of the bits of advice is to recognize your stress, to talk about it, which is what we've been talking about here, to think about what helps you cope, to keep your cool, which is hard sometimes, but keep your cool, and to do what you love, what motivates you. That helps a person center, I think. There we go. So there, we'll go over those topics again. Recognize your stress, talk about it, think about what helps you cope, keep your cool, and do what you love. And then remember that stress is temporary. That's really hard sometimes, to remember that stress is temporary. Get moving. I want to talk about that in a second. Get moving, go for a walk, play your favorite sport. That physical activity, I think, can be very enhancing for your mood. Help others. I think one of the best things we can do is feel needed. So you could also reach out and help others. To take care of yourself. And we all know what that means, you know, whether it's yoga, a good night's sleep, remembering to breathe every now and then, to breathe deeply and relax yourself, to have a good focal point. And don't rely on alcohol or drugs to self-medicate. That can be a real dark hole that you can go down. I want to come back to the get moving thing because it's been my experience sometimes that taking a walk in your neighborhood, getting out, just getting the fresh air, getting the sunshine can be really nice. Hopefully people have the time in the day to do that. But I also had an experience of walking with teenagers. And we might start out not saying much, but by the time we'd gone a mile and a half, boy, everything was pouring out. And just walking and talking, because it was a neutral setting. It wasn't face-to-face, eyeball-to-eyeball intense. It was just walking and talking. So that's really good advice that comes up about dealing with stress and helping yourself.
I've seen that in my office. My office is in Ridgewood. And there are some teenagers who can sit and talk for almost an hour, but there are many who are very uncomfortable doing that. So you will see me walking around Ridgewood with a teenager sometimes, and even stopping to get a cookie or something in the bakery, and it does make all the difference in the world. Yeah. And with younger children also, being active even in the office, throwing a ball back and forth with them will just start them chattering away. Yeah, you say you're right about that.
And there's even some research that shows that a brisk 30-minute walk 3 to 5 times a week results in a decrease in depression and anxiety. You know, like a 20-30% decrease. It's one of the first things I always recommend to anyone who's having panic attacks or suffering with anxiety and depression. Get moving, and it's a help in itself. You know?
And sometimes when you get in that dark mood, you don't think about it, but you do have to teach yourself. You know, make it a discipline to get moving.
We find it as an issue for us as well. Seriously, for
Self-care.
Self-care.
Yes.
Big topic.
Well, my
for
goodness.
ourselves.
Yeah, see, that's the other thing too. You folks, and I said this actually once to a rabbi, like, how do you cope? Everybody comes to you and lays everything on you. How do you cope? And the rabbi said to me, well, we talk to each other. You know, we the clergy talk to each other. So I hope that you all have that ability to support each other.
Absolutely. Absolutely.
Yeah.
Yeah, I think many of us have been in peer supervision groups and consultation groups. And
Yeah. Also, the organizations
Yeah.
help a lot because we're with our peers, and we have our NCAP has, and NJPA has conferences, workshops, presentations on topics like that, and we can share these things, and we can feel understood and heard.
Yeah.
We can get refueled that way.
That's good. Yeah.
And it's also not, against the law for a psychologist to go to a psychologist.
quite common.
It's true.
Absolutely.
It's hard as
It's healthy.
because one of the main self-care strategies is to put yourself first, but that's hard if you're a psychologist. You're putting other people first all day, so you want to be able to, whether it be peer supervision or therapy.
Yeah.
Well, it used to be a requirement to get through a
Yeah.
doctoral program
Yeah.
that you had to be in
that's true.
therapy. You needed a certain number of hours. And also there were postdoctoral programs, and I did a 3-year postdoctoral after my doctorate in New York, and the requirement was that you need a certain number of hours in therapy for that as well.
Yeah, I think most of us avail ourselves of that from time to time. That's
That's
one of the
true.
ways we cope,
Yeah.
because it stirs up issues for us.
Yeah,
Sure.
absolutely.
Oh, absolutely. I'm sure. I'm sure. Yeah. We have covered a lot of stuff, and we could talk all night. I know that. Is there anything any one of you wanted to touch
Yeah.
on?
I think it came through in our conversation that you don't have to have serious emotional disturbance to be in therapy. You don't have to be crazy. You don't have to, be schizophrenic or have other, serious disturbances. That I think for most of us, most of the people we see are people who are coping with sometimes fairly common problems that people cope with. And we're helping them to be more self-aware, to understand why they behave the way they do. I think we've all had the experience of saying something or doing something and then thinking, why in the world did I do that? I have no idea why I did that. There are reasons, we're just not aware of them. And sometimes bringing that information into awareness can help people feel emotionally more balanced, more in control of themselves and their behaviors and their emotions, not get so overwhelmed when things go wrong. Things are always going to go wrong. And just be able to be more authentic person. So I just do want to emphasize that you don't have to have serious mental disturbance to be in therapy.
And similar to a medical condition, it can get worse if you don't address it early.
That's right.
That's true.
So
And it's a healthy sign when you do seek help early on. And if it's not early on, most people realize, I can't cope with this. I can't go to family. I can't talk to anyone at work. I need an objective voice. So they'll seek it out. And I always tell people who come to therapy that the research says, from my days from Fairleigh Dickinson and doing research, that the research indicates that by the time you get to the office, you're 33% on the way in the process of healing yourself, because it takes a lot of courage to first realize you have an issue, then look someone up, then make the call, and then show up. So that's a lot of work. So people feel some relief the first time they come into session because they've traveled a distance already. And so now they can talk to someone objectively about what's happening to me. So it's always an experience for me when people come in and they have a sigh of relief and they begin to tell their story.
Yeah. The other thing we haven't touched upon that's relevant in what you were just saying, Yolanda, is how it kind of spills over into your relationships. So not only are you hurting yourself, but someone once said, "What you don't work through, you spew on other
Oh,
people."
boy.
You know, and I think there's a lot of truth,
Yes.
a lot of truth in that. You know, so that it can improve your relationship with the people most important to you.
Yeah.
I wanted to touch on something, and in a way this goes back to the mind-body thing and the body thing. If I may, I apologize for laying this on you. A thing that happened to me, I had a reaction to a medication, and people have to be aware of that too. I had a root canal situation working up, and the dentist gave me penicillin with potassium. Within a day or two, I was in a black cave. I was, and I said to my pharmacist, "Is this a normal reaction?" We never heard of that before. My GP, they never heard of that before. Said to my dentist, they never heard of that before. But the dentist said, "Stop taking the medicine, whatever. Stop taking it." So on the advice of my dentist, I did stop taking it. He says, "If you don't feel better in a day or two, call me." And I did. Once that stuff got out of my system, I did feel better. And so that's another thing too. People have to be aware if a medication might go wrong, or you might have a
absolutely.
reaction to it.
Some medications, like
yes.
steroids, for example,
Right.
can have
Oh
a
my
really
gosh.
strong effect on people.
Yes, yeah. There we go. We could talk all night. There are so many facets to this. I know that we also have slides on where in Bergen County Department of Health Services we can get more information. So as we wrap up, we'll go through those slides, and thank you very much for coming. I hope that you have a good turnout on May 19th. I hope that this talk and this information that people see here on this screen can help them at times of distress, times of stress, or help them even get help for their loved ones, their friends. Teenagers, reach out. Adults, reach out. Elderly, reach out, and reach out for your friends and your other members of your family. A lot of this information is available online again. You can Google any topic, and I'm sure you're going to find exactly what you need. But be smart, be educated, learn about what's available and what it means to you, so that you don't go down a wrong path and get wrong advice. It's like we said tonight, feel comfortable with the person that you're seeing as a professional. And again, good luck on the 19th. Thank you.
Thank you.
Thank you.
Thank you for coming
Thank
tonight.
you for having us.
Thank you.
We have one final clip from the Born This Way Foundation. So before we see that, let me say thank you to our crew tonight, Nick and Shane and Fred and Paul and Larry and Ida and Rick. We've got everybody here tonight. So for WCTV in Washington Township, thank you for joining us, and enjoy this final clip.
I know what it's like to feel depressed, to feel humiliated, to feel isolated. And I know too many young people that no matter who they are or where they come from, they're feeling the same way that I do. And it was so beautiful in a way that our sadness bonded us at the shows, and yet I so badly wanted to understand why that cloud was there at all. How could I help to lift it? How could I help be a part of a more global change? And working together, we can make the world a kinder and braver place where all voices are heard, all feelings are respected. It's okay to be different. It's okay to feel different. It's okay to feel like you're not part of this planet, because there's all sorts of really authentic answers as to why. And that's why my mom and I started the Born This Way Foundation. I challenge you today to be your biggest fan and join the emotion revolution by going to bornthisway.foundation. Tell the world how you feel, but more importantly, tell them how you want to feel.